My name is Kyla. I'm going to be your nurse today. What's your name?
Randy,
What's your date of birth?
November 3rd, 1987.
Okay. Nice to meet you, Randy. Today we're going to be doing a head, eyes, ears, nose, and mouth exam. First, I'm going to start by just assessing your general nutritional status. You appear to be healthy, maybe a little bit tired. Seems reasonable. BMI, what is your height?
5'10"-ish,
Okay. And then what's your weight?
180.
So to calculate BMI, what I would do is I would take your weight, convert it into kilograms, and your height, convert it into meters, and divide your weight in kilograms by meters squared. For you, it's going to be 25.8. Next, I'm going to assess your head. What I'm looking for the head is size, if it's proportional to your body, which yours is, if it's symmetrical, which it is. Now I'm just doing a quick little inspection to see if I see any noticeable lesions, any like general scaling or redness. I don't see anything. Your skin is uniform across your head. Next, what I'm going to do is kind of inspect your face a little bit more closely. I'm looking for lesions or edema. I don't see any lesions or edema. Your skin appears to be smooth. Next, I'm going to evaluate your eyes, starting with your eyebrows. Your eyebrows are thick and symmetrical. I don't see any flakes or scaling or any like hair patches. Next, I'm going to move on to your eyelids. Can you close your eyes for me? What I'm looking for here is to see if the coloration matches the rest of your face, which it does. You can go ahead and open up your eyes for me. Next, I'm looking at your eyelashes. Your eyelashes are going out and up on top and out and down on the bottom. Next, we'll look at your conjunctiva. If it's okay with you, what I'm going to do is I'm going to take my fingers and press down a little bit just to pull down your lower eyelids. So go ahead and look out for me, pulling down. It's pink. I don't see any swelling. I don't see any sort of discharge that would indicate an infection or anything like that. Next, we'll look at your sclera. It's white. I don't see any discoloration or anything like that. Next, I'm gonna look at your corneas for opacities. I don't see anything like that. There's no discoloration, and your conjunctiva appears to be clear. Your irises are round, and the color appears to be brown, and it's uniform. They're both the same size. Next, what I'm going to do is evaluate your pupils. Right now, they appear to be the appropriate size for the current light environment, approximately, say, 7 millimeters. What I'm going to do for this part of the assessment is I'm going to turn off the light. I'm going to shine the light near your eyes to look for the pupil response. It'll be pretty bright, just giving you a heads up. Okay, starting with this eye. It's really bright. Good. And this eye, perfect. Okay. So what I wanted to confirm there is to see if your eye pupil would shrink down to about 2 millimeters, which it did. They were both equal, round, and responsive to light. Next thing I'm going to do is check your visual assessment. So we're going to start with peripheral. So what I'm going to do for this assessment is I'm going to have my hands kind of behind your head and bring them forward. Let me know when you see my hands, okay? Start back here.
Yep.
Start back here.
Yep.
Beautiful. Your peripheral vision is intact. Next, I'm going to look for how smooth your eye muscles are functioning. So you're going to continue looking forward, but your eyes are going to track my finger, okay? Starting over here. Perfect. No nystagmus. Your eye movement was smooth, and your extraocular vision is intact. Next, we're going to look at your visual acuity using this card. What you're going to do is hold this approximately the distance you would read a book, about 14 inches, and you're going to be able to just read the lowest line that you can. Try to read this line on the bottom if possible. Cover up one eye, read it, cover up the other eye, and then read it.
426,739.
Okay. Switch eyes.
426,739.
Okay. And now do it together.
426,739.
Congratulations, you've got 20/20 vision. Next, we're going to move on to inspecting your ears. What I'm looking for here for a general inspection is just to see if the skin is intact, they're symmetrical. Now I'm kind of looking for whether the top of the pinna of your ears aligns with the canthus of your eyes, which it does. If there was any sort of irregularity, I'd want to make sure that it is less than 10 degrees. If not, make a note. Skin's intact. The color is uniform with the rest of your skin, and there's no obvious deformities. Next, I'm inspecting your nose. Your nose is symmetrical. It's in the center of your face, as expected. There's no lesions, there's no edema. The color is appropriate for the rest of the skin on your face. It's midline, and the size is appropriate for the rest of your face as well. Next, we're going to move on to your lips. What I'm looking for here is color, moisture, and if there's any lesions. It's pink, appear to be moist, no serrations, sores, or lesions. Next, what I'm going to have you do is open up your mouth. We'll go ahead and we'll start with your teeth. So give me a big smile. Beautiful. Do you have any teeth that are missing?
No.
Okay, beautiful. I don't see any missing teeth. Appear to be healthy. They're white. They're all intact. Next, what I'm going to have you do is just kind of like really big smile. I'm going to try to look at your gums, okay? Perfect. Your gums are pink. They're smooth. I don't see any lesions. I don't see any bleeding or anything like that. Can you do me a favor? Just pull down your lip a little bit. Beautiful. It's consistent. Pink, smooth, no lesions. Next, what I'm going to have you do is just open wide, and I'm just going to inspect your oral mucosa. It is pink, smooth, and I don't see any lesions, any serration, any bleeding. Go ahead and stick out your tongue and say ah. Perfect. I'm looking at your pharynx. It's also smooth and pink. Your uvula is also smooth and pink, and in the center doesn't appear to be enlarged. My patient doesn't have any tonsils, so I'm unable to evaluate that. I also am anosmic, so I cannot evaluate the patient's smell. However, if I saw anything that might indicate that it might produce a smell, I would have another nurse come in and assess that. Tongue movement, the patient's been communicating with me clearly this entire time, as it appears to have good tongue movement. Going back to ears for a second, I did not perform an ear hearing exam because the patient has been able to have a clear dialogue with me this entire time without me having to raise my voice or ask any clarifying questions. So I know that his hearing is also intact. Moving on to the neck, what I'm inspecting here is seeing if everything is midline symmetrical. It is. Starting with the trachea. Trachea is midline and symmetrical. Next, I'm looking for color. Color is appropriate for the rest of the patient's skin tone. I don't see any redness. I don't see any edema. I don't see any lumps. What I'm going to assess next is just your lymph nodes. So what I'm going to do here is I'm just going to kind of palpate around your neck. What you're going to do is let me know if you feel any tenderness or pain. If you do, please give me a heads up and I can reassess the assessment. What I'm going to start assessing is the pre and post auricular. So here's the pre. Feel anything?
No.
Good. Over here. Next, occipital, excuse me. And then tonsillar, submandibular, submental, anterior cervical, posterior cervical. Here is anterior cervical and supraclavicular. And what I'm feeling for here is any masses. If I did feel a mass, I would evaluate for size, consistency, mobility, and again, if the patient tells me they experience any tenderness. Did you feel any tenderness during that exam?
No.
Perfect. Thank you so much for participating today.
You're welcome.